In this video, we will be reviewing the anticoagulant flow sheet. First thing you want to do is check the patient in from the clinical visit console. Then click on the patient's name to enter the progress note. On the right chart panel, you want to click on DRTLA and then select the INR ratio that you're reviewing. You want to mark the lab as reviewed. You're going to click on Options and then select Anticoagulant Flow Sheet. At the top, you want to select the appropriate MD. And then mark off whether the patient is enrolled in the anticoagulant program. So you'll mark yes. You want to click the ellipsis next to diagnosis and then search for the appropriate diagnoses and hit close. For a new patient, you want to make sure that you enter the target INR, so the from and to. And then document what the patient's current INR was. Enter how many milligrams the patient is getting of Coumadin, and you can set to default. If applicable, you'll enter additional tab strengths. Be sure that if you're adding an additional tab strength, you do not select set to default. You'll click advice. For a new dose, you want to enter the new dose. You will enter the same above. If it is changing, you will document the changes. Be sure to complete the indication section. And also complete the side effects section. You're going to document the recheck date as needed. Internal notes does not show up in the patient documents. Regular notes does show up in the patient documents. So you'd enter notes as necessary. We are not going to click use recommended or use old. You can hit save on the anticoagulation flow sheet. It'll tell you that the data was saved successfully and you'll click OK. And then click OK on the window. If you are adjusting the dose of Coumadin for the patient or adding any other orders, you would select treatment and follow the workflow 9A, 9B. If you needed to order additional labs, you will also click treatment and follow workflows 13A and 13B. Complete any other documentation as necessary and be sure to lock your encounter. Always run the clinical rules engine. Be sure to lock the encounter. Navigate back to the clinical visit console and change the status to WP. So change status to and select WP and click OK.